My name is Chelsea St. Clair, and my topic for my informative speech will be about heart attack or heart disease. A little fact to kind of put in perspective would be about 600,000 people die each year in the United States from heart disease, whether related to or directly cause of. And that's actually 1 in every 4 deaths are related to heart disease. We'll answer a question of what is specifically a heart attack. A heart attack is when there is oxygen-rich blood that is going through the heart in the arteries that is abruptly stopped, whether it be due to a blockage of plaque or blood clots. But over here, it shows that there is plaque that builds up that actually hardens, and a piece of it will actually break off. Platelets, which is part of the clotting, part of the blood that actually forms clots, will form a blood clot around here, restricting blood flow to the rest of the heart. Right here, this shows that this piece of the heart, or part of the heart, is actually blocked and damaged from the heart attack, or the blockages going on. And with that, once that part of the heart is blocked for a certain amount of time, the heart will actually die, and you can't get that to regenerate or improve ever again. That part of the heart will, for then time, be permanently damaged. Next, just some risk factors, specifically uncontrollable risk factors. Age, for men over 45 have an increased risk of heart disease or heart attack, and women over 55 have an increased risk of heart attacks. Also, genetics plays a big role in that. If your parents or if your brothers and sisters all have heart problems, that is puts you at an increased risk of having heart attacks. Also, preeclampsia, which is when pregnant women can have this, which can increase their risk of having heart attacks during or directly after pregnancy. Some controllable risk factors, one would be smoking. Smoking doesn't just injure the lungs as much as it does the heart. The heart is probably an equal part of injury due to smoking, and that is because smoking causes your blood vessels to constrict. So if there is any blockages that are in your vessels, it constricts down and minimizes the amount of blood flow that can go to the rest of the heart. Also, high blood pressure, high cholesterol, overweight and obesity, unhealthy diet, specifically trans fat, saturated fat, cholesterol, and sodium. That is part of the process that forms plaque and increases the amount of plaque that is in the heart. Also, lack of exercise and high sugars due to diabetics or diabetes. Next, some signs and symptoms of a heart attack. There are classic signs and symptoms of a heart attack, and men more usually get the classic signs, which is chest pain, dull, achy pressure in the chest, feels like someone's sitting on your chest, and that pain can go down to your left arm and up your jaw, up to your jaw. For women specifically, they tend to get more of the atypical signs of chest pain, whether it be just weak for a number of days, nausea and vomiting, really tired and sweaty. And with that, that's why women have when they do have a heart attack, more of the time it is more severe because they think that it might just be an upset stomach or indigestion instead of actually relating it back to the heart. Also, with all of that, you can have rapid or irregular heart rate, anxiety and shortness of breath because they can't feel like they can expand the lungs and take a big deep breath, so they get anxious and increase as many times their breathing. Diagnosing a heart attack, how to diagnose a heart attack. The first and main way to diagnose a heart attack is an EKG. This is what's also known as electrocardiogram. It is a very simple, very quick, it takes approximately 2 minutes to set up and to complete this exam. It's a whole bunch of stickers and wires on your chest, and this monitors the electrical activity part of your heart, or your heart rhythm right here. And a physician or a paramedic or a nurse can look at this EKG and see if there's any damage going on to the heart or any lack of oxygen that's going on to the heart with that. Also, they would do, once you get to the hospital or urgent cares, they would do blood tests. This would be called cardiac enzymes. When you are having a heart attack or if there is any heart damage going on, this cardiac enzymes will elevate. And between an EKG and the blood test, that's when they can more define, say yes or no, you are having a heart attack or it is related to the heart. Specifically coronary angiography, that is another test, but it's not as commonly used because it does take a long time. This is actually a CAT scan where they inject dye, and this dye goes through your blood vessels, and under the CAT scan they can see if there is any blockages in your heart. But with that test probably takes 20 minutes at least, and then 45 minutes to an hour, if not longer, for a radiologist to read that CAT scan, therefore delaying the time and treatment that can be given to that patient. Ultimately, if these EKG and the blood test results show positive, that you are having a heart attack, the cardiologist will take you to what's called a cardiac catheterization. With that, they go in through either your wrist or your groin, go into your main blood vessels and go up to the heart under ultrasound, and they can see if there is any blockages and there further treat that right then and there. Treating a heart attack, first, the simplest thing is oxygen. Giving a patient oxygen, even though there is minimal amount of blood flow, if you give a patient oxygen, that will increase the oxygen on the blood and making that blood, the minimal amount of blood that is there, more effective. Also, aspirin thins the blood and prevents further clotting, therefore allowing more blood to pass. Also, nitroglycerin, patients take this, it can be a spray or a tablet, and put it under their tongue, and that will actually dilate the blood vessels enough and allow for any other or more blood to go through, even if there is still blockage there. Also, clot busting medications break up the clot. An angioplasty, this is where they go in to the blood vessel, put a balloon up and kind of pushes the plaque against the vessels, kind of opening it up and making way for blood to get to that, the rest of that part of the heart. And lastly, when they're doing that angioplasty, depending on the patient and the cardiologist, most of the time we'll put a cardiac stent. It's kind of like chicken wire. Once they push that plaque to the side of the vessel, they'll put a stent in there, kind of keeping that blood vessel open and patent, therefore allowing more blood to go through. And hopefully that there will not be any regrowth of plaque and stop that stent from working from there. Otherwise, that's how you treat a heart attack. Is there any questions? Okay, well, thank you for listening to my speech.